If you're alone and experience sudden, severe symptoms, every second counts. The average ambulance arrives in 8 to 12 minutes. What you do in that critical window can save your life. A study in the American Journal of Emergency Medicine found that patients who took specific, strategic actions before paramedics arrived doubled or even tripled their survival rates. Today, we're giving you a clear, medically reviewed protocol designed specifically for Americans age 50 and older. We'll cover what to do, what not to do, and how to recognize the difference between a heart attack and other serious conditions. Before we begin, download the printable wallet card in the description below. Keep it in your purse, wallet, or on your refrigerator. Share it with your spouse or caregiver. Let's get started. Step 1. Recognize the symptoms. This could save your life. Most people wait too long because they don't recognize the warning signs. Classic heart attack symptoms: crushing or squeezing pressure in the center of your chest lasting more than a few minutes, pain radiating to your left arm, jaw, neck, or back, shortness of breath, cold sweats, nausea. WOMEN, your symptoms may be different. Women over 50 often experience heart attacks without chest pain. Extreme, unusual fatigue, for days or weeks before, shortness of breath without exertion, nausea, indigestion, or stomach pain, pain in jaw, neck, or upper back, lightheadedness or dizziness. Many women mistake these for flu, anxiety, or indigestion. This delay is deadly. Trust your instincts. Critical: is it a heart attack or a stroke? Before taking aspirin, quickly check for stroke symptoms using FAST. Face: ask yourself to smile. Is one side drooping? Arms: raise both arms. Does one drift down? Speech: try to say a simple sentence. Are your words slurred? Time: if any of these are present, call 911 now. Do not take aspirin. Why this matters: strokes can cause chest pain or arm pain. If you're having a bleeding stroke, aspirin could be fatal. When to skip aspirin entirely. Any stroke symptoms: face drooping, arm weakness, slurred speech, recent surgery or injury, within 2 weeks, known stomach ulcers or recent bleeding, severe aspirin allergy, already taking blood thinners like warfarin, Eliquis, or Plavix, call your doctor. If you're unsure, call 911 first and ask the operator if you should take aspirin. Step 2. Call 911 immediately, before anything else. Do not drive yourself to the hospital. Do not wait to see if it gets better. When you call 911, say immediately, "I think I'm having a heart attack. I'm alone." Give your exact address including apartment number, note the time, write it down or tell the operator to record it. Critical for hospital treatment: list your medications, especially blood thinners, warfarin, Eliquis, Xarelto, erectile dysfunction medications, Viagra, Cialis, Levitra, blood pressure medications, diabetes medications. Stay on the line unless the operator tells you to hang up. Special situations: if you're hard of hearing, text 911, available in most U.S. areas. Program this before an emergency. Use a TTY device if you have one. Alert your smart speaker, Alexa, Siri, Google, call 911. If English is not your first language, 911 operators have access to translation services. Say your language clearly: Spanish, Mandarin, Russian. They will connect you to an interpreter. If you live in a rural area, response times may exceed 20 to 30 minutes. Ask the operator about helicopter transport if available. Consider calling a neighbor or nearby family member simultaneously. If you're in an apartment or gated community, tell the operator about security gates or access codes. Immediately call building security or a neighbor to meet the ambulance at the entrance. Do not let a locked lobby door delay help. If you have a medical alert device, press the button. They will call 911 for Humani services. Notify emergency contacts automatically. Step 3. The Lighthouse Strategy: help them find you fast. Emergency response logs show that locked doors add an average of 4 to 7 minutes to patient contact time. During a heart attack, 4 minutes can mean the difference between full recovery and permanent heart damage. Immediate actions: unlock your front door and open it slightly. Use a shoe, book, or doorstop to prop it open. If you have a screen door, prop that open. 2. Turn on every light: porch light, living room lights, hallway lights, exterior lights if you have them. Why? ambulance crews scan for the brightest house on the street, especially at night. This helps them find you without checking house numbers. If you have pets, put dogs in a separate room if possible. This prevents delays from scared or protective animals. Important for multi-story homes. Stay on the main floor where the front door is. Do not go upstairs to bed. Paramedics need easy access to you. For seniors with mobility challenges. If you use a walker or wheelchair, position yourself near the front door if safely possible. If you're upstairs and can't get down, unlock/open the front door, then make noise, yell, bang on floor, so paramedics know where you are. Step 4. Aspirin the right way, if safe for you. Stop, review the when not to take aspirin section above before proceeding. If you've determined aspirin is safe for you. The protocol. Do not swallow the aspirin whole. Swallowing takes 30 to 40 minutes to work. You need it working in 5 to 15 minutes. Chew the aspirin. Take 1 regular strength aspirin, 325 mg, non-coated/non-enteric, or 481 mg baby aspirins. If that's what you have, chew it thoroughly into a fine, chalky paste. Let it mix with your saliva. Swallow the paste. Why this works: chewing breaks the pill into tiny particles that absorb through the membranes in your mouth and throat, entering your bloodstream much faster than a swallowed pill traveling through your stomach. The taste will be bitter and unpleasant. Ignore the taste. This could save your life. Medication safety warnings. Do not take aspirin if you're already on blood thinners. Call your doctor or ask 911 operator. You take daily NSAIDs like ibuprofen or naproxen, they interfere with aspirin. You have a known bleeding disorder. You've shown any stroke symptoms. If you're on these common medications, ask the 911 operator. Warfarin, Eliquis, Xarelto, Plavix, blood thinners, SSRIs for depression, can increase bleeding risk, corticosteroids, prednisone. Where to keep aspirin. Preposition regular aspirin in easy-to-reach places. Bedside table, kitchen counter, bathroom, medicine cabinet near your favorite chair. Check expiration dates every 6 months. Expired aspirin loses effectiveness. Step 5. Nitroglycerin, if prescribed to you. This section only applies if your doctor has prescribed nitroglycerin for you. Do not use someone else's medication. What nitroglycerin does. While aspirin stops the clot from growing, nitroglycerin relaxes and widens your blood vessels, allowing blood to flow more easily around the blockage and reducing your heart's workload. The safe nitro protocol. Critical, the 3-step rule. 1. The seat, never stand. Sit down before taking nitroglycerin. Sit on the floor with your back against a wall, sofa, or bed. Never take it standing. It drops blood pressure rapidly and you will faint and fall. 2. The placement, under your tongue. Place 1 tablet or 1 spray under your tongue. Do not swallow it. Stomach acid destroys it. You should feel a slight burning or tingling under your tongue. If you don't feel tingling, your medication may be expired. 3. The 5-minute loop. Wait exactly 5 minutes if chest pain persists. Take a second dose. Wait another 5 minutes if pain still persists. Take a third dose. Do not exceed 3 doses total. Deadly medication interactions. Absolutely do not take nitroglycerin if you have taken any of these in the past 48 hours. Erectile dysfunction drugs: Viagra, sildenafil, Cialis, tadalafil, Levitra, vardenafil, Stendra. The combination causes catastrophic blood pressure collapse that is often fatal. Also check with 911 operator if you take alpha blockers for prostate issues, tamsulosin/Flomax, doxazosin, blood pressure medications, diabetes medications. Nitroglycerin shelf life: pills lose potency 6 months after opening the bottle. Write the date you opened it on the bottle. Pills should cause a tingling sensation. If they don't, they're likely expired. Spray versions last longer. Check expiration date. Store in original container, away from heat and light. If you've been prescribed nitroglycerin but don't have it with you, focus on the other steps. Don't delay calling 911 to search for it. Step 6. The rescue position: use gravity to help your heart. Most people's instinct when feeling weak is to lie flat. This is a potentially dangerous mistake during a heart attack. Why lying flat is wrong. When you lie flat, gravity causes blood to pool in your chest. Your struggling heart has to work harder to pump that blood out, increasing the workload on an already damaged muscle. The W position, recommended by cardiologists. How to position yourself. Sit on the floor, not a chair. If you faint, you won't fall far. Lean your back against a wall, sofa, or sturdy bed frame at a 45-degree angle. Bend your knees and keep your feet flat on the floor. Your body should form a W shape. Why this works? Reduces heart workload. Gravity keeps some blood in your legs instead of flooding your chest. Maximizes breathing. Sitting upright allows your lungs to fully expand. Lying flat compresses your lungs with your stomach and liver. Improves oxygen levels. Studies show this position maintains significantly higher blood oxygen than lying flat. Safe. If you faint, you're already on the ground. For seniors with mobility issues. If you cannot get to the floor, sit in a sturdy chair or on your bed. Prop yourself up with pillows at a 45-degree angle. Do the best you can. Sitting upright is better than lying flat. If you use a wheelchair, lock the wheels. Recline slightly if your chair allows. Elevate your legs if possible. If you have severe arthritis, adapt the position to what your body allows. Any semi-upright position is better than completely flat. Step 7. Breathing. Break the panic cycle. When chest pain hits, your brain triggers a fight or flight response. You start breathing fast and shallow. This is called hyperventilation. The problem: hyperventilation actually constricts your blood vessels at the exact moment your heart desperately needs oxygen. Your panic is making things worse. You must manually calm your nervous system. The vagus nerve breathing technique. This technique stimulates the vagus nerve, which acts like a brake pedal for your heart rate. How to do it? Inhale slowly through your nose for 4 seconds. Focus on expanding your belly, not lifting your shoulders. Hold for 2 seconds. Exhale slowly through pursed lips, like blowing through a thin straw, for 8 seconds. The exhalation must be longer than the inhalation. This is the key to the technique. The science: when you extend your exhale against the resistance of pursed lips, you create positive pressure in your lungs. This stimulates the vagus nerve, which releases acetylcholine, a chemical that tells your heart to slow down and your blood vessels to relax. Repeat this cycle. Continue until paramedics arrive. If you can't count, just make your exhale twice as long as your inhale. This is not the paper bag technique. That's for anxiety attacks, not heart attacks. If you have COPD or asthma, do your best with the technique, but don't force it. Focus on staying as calm as possible. Use your rescue inhaler if prescribed. Tell the 911 operator about your breathing condition. Step 8. The timestamp, critical for hospital treatment. There's a class of powerful drugs called thrombolytics, clot busters, that can dissolve the clot in your heart and restore blood flow, potentially preventing permanent damage. The catch: doctors can only give these drugs if symptoms started within a specific time window, usually 3 to 12 hours depending on the drug. After that, the bleeding risk outweighs the benefit. If you arrive at the hospital unconscious and can't tell them when your pain started, they may be legally unable to give you this life-saving treatment. How to record the time. When you call 911, the operator will record the time automatically. Tell them, "My chest pain started at exact time." They document this in the dispatch record. Additional backup methods. Write it down if you have paper and pen nearby. Example: chest pain started 2:35 p.m. Thursday. Put it in your pocket. Text it to an emergency contact. Having chest pain. Started 2:35 p.m. Called 911. Tell your smart speaker to note the time. Alexa, note the time. Chest pain started now. If you have an Apple Watch or Fitbit, it may automatically record heart rate spikes. Emergency responders can access this data. What else paramedics need to know? Prepare this information. Keep a list on your refrigerator. Current medications, all of them, including prescription medications, over-the-counter drugs, supplements and vitamins, herbal remedies, allergies especially to medications, contrast dye, used in heart catheterization, medical history, previous heart attack or stroke, diabetes, high blood pressure, high cholesterol, kidney or liver disease, recent surgeries, emergency contacts, name and phone number, relationship to you. Many seniors keep this on a card in their wallet labeled ICE, in case of emergency, or on their refrigerator under a magnet. What to do while waiting for help? You've called 911. You've unlocked the door and turned on lights. You've taken aspirin, if safe. You're in the W position, breathing slowly. Now, stay as calm as possible. Focus on your breathing. Don't pace or move around. Conserve energy. If you live with someone, alert them immediately. Have them gather your medication list. Ask them to wait by the door for paramedics. If you're completely alone, keep your phone with you. The 911 operator may stay on the line with you. Don't hang up unless instructed. Do not eat or drink anything. You may need surgery. Smoke constricts blood vessels. Take a shower or exert yourself. Drive yourself to the hospital if symptoms suddenly stop. Do not cancel the ambulance. This could be a warning sign of an even bigger heart attack coming. Let the paramedics evaluate you. They can do an EKG on scene. Special considerations for different living situations. If you live alone, consider a medical alert system, Life Alert, Medical Guardian, Apple Watch fall detection. Set up daily check-ins with a neighbor or family member. Keep a spare key with a trusted neighbor. Post emergency protocol on your refrigerator if you're a caregiver. If someone you care for is having a heart attack, call 911 immediately. Help them into the W position. Give them aspirin to chew. If no contraindications, gather their medication list. Stay calm. Your calmness helps them stay calm. If they become unconscious, be prepared to perform CPR. 911 will guide you. If you have dementia or cognitive impairment, wear a medical alert bracelet at all times. Keep emergency instructions in large print in multiple locations. Program 911 into speed dial. Ensure caregivers know your protocol. Consider automated medication dispensers with alerts. If you live in assisted living, know your facility's emergency protocol. Verify staff will call 911. Some facilities try to handle emergencies internally. This can be deadly. Keep your own aspirin supply. Alert front desk immediately before returning to your room after the ambulance arrives. What to expect at the hospital: emergency room, EKG, heart rhythm test. Immediately blood tests to check for heart damage, possibly a chest X-ray. IV line for medications. Continuous heart monitoring. Possible procedures: cardiac catheterization, a thin tube inserted through your wrist or groin to look at your heart arteries. Stent placement, a tiny mesh tube to open blocked arteries. Bypass surgery, in severe cases, less common as emergency procedure. Medications you'll likely receive: blood thinners, beta blockers, slow heart rate, ACE inhibitors, lower blood pressure, statins, cholesterol medication. Recovery and PREVENTION cardiac rehabilitation, covered by Medicare Part B. After a heart attack, your doctor will likely prescribe cardiac rehab, a supervised program that includes monitored exercise, nutrition, counseling, stress management, medication management, education about heart disease. This is not optional. It reduces your risk of a second heart attack by up to 47%. Secondary prevention. Lifestyle changes that matter. Medications. Take them exactly as prescribed. Most heart attacks in the first year happen when people stop their medications. Diet. Mediterranean diet reduces risk by 30%. Exercise. 30 minutes of walking 5 days per week. Smoking. Quit completely. Even 1 to 2 cigarettes/day doubles heart attack risk. Stress management. Chronic stress increases risk. Sleep. 7 to 8 hours/night. Blood pressure. Keep below 130/80. Cholesterol. LDL below 70 if you've had a heart attack. Diabetes. Keep A1C below 7%. Follow-up care. Cardiologist appointments every 3 to 6 months. Regular EKGs and stress tests. Medication adjustments as needed. Annual flu shot and pneumonia vaccine. Infections stress the heart. Know your risk. Prevention starts today. You are at higher risk if you have family history, parent or sibling with heart disease before age 55, men, or 65, women, age, men 45 plus, women 55 plus, risk increases with age, high blood pressure, above 130/80. High cholesterol, LDL above 100. Diabetes or pre-diabetes. Smoking, current or former smoker. Obesity, BMI over 30. Sedentary lifestyle, less than 150 minutes exercise/week. Chronic stress or depression. Sleep apnea, untreated. Talk to your doctor about baseline EKG, heart rhythm test, stress test if you have risk factors. Calcium score test, measures plaque in arteries. Daily aspirin, only if your doctor recommends, not for everyone. Blood pressure and cholesterol medications. Medicare covers annual wellness visit. Cardiovascular screening every 5 years. Diabetes screening. Smoking cessation counseling. Survival from a heart attack depends on 2 things: recognition and action. Now you know. How to recognize a heart attack, including women's symptoms, how to differentiate from a stroke, the exact steps to take while waiting for help, what medications are safe and unsafe, how to position yourself for best outcomes, how to stay calm and breathe effectively. The statistics are clear. People who follow this protocol and call 911 immediately have 2 to 3 times better survival rates than those who wait or try to tough it out. Share this information. Send it to your spouse, adult children, and close friends. Print the wallet card and keep it visible. Discuss it with your doctor at your next appointment. Review it twice a year. Leave a comment below. Do you know your family history of heart disease? Have you had your blood pressure and cholesterol checked recently? What questions do you have about this protocol? Your engagement helps this life-saving information reach other seniors who may be alone right now. Most importantly, schedule an appointment with your doctor to discuss your personal risk factors. Ask about whether daily aspirin is right for you, if you should have a nitroglycerin prescription, your baseline cardiovascular health, what your target blood pressure and cholesterol should be. This video is education, not medical advice. Your doctor knows your health history and can personalize this protocol for you. Stay prepared. Stay informed. Stay alive. We'll see you in the next video.